great story about how you got involved with this. And I just wondered if you would be kind enough to let us hear it once more, because it is very moving.
Thank you, absolutely. We had a family in Georgia whose the father was passing away. He was in hospice care and was diagnosed with terminal cancer. And he was given about 3 months at that point to live. Unfortunately, he wound up actually with a perforated bowel as well. Was unable to complete all of his treatments, and so we knew he wasn't going to live long. He was having great difficulty communicating with his family. And so, you know, he couldn't have those wonderful end-of-life conversations that we need to have. You know, couldn't have the I'm sorry's and the, you know, I forgive you's because it was very difficult. And, you know, as you know, it's very hard when you're speaking with someone hard of hearing. It's very difficult to sound sympathetic and loving if you're having to shout, you know, I forgive you, you know, I understand why you made me come home at 10 o'clock. You know, they don't get it. So those conversations are very, very difficult to have when you're having difficulty communicating. And so what we were able to do is we were able to actually lend a pair of hearing aids to the father so that he was able to have those wonderful conversations in a sweet, loving tone of voice with his family members. So instead of not being able to communicate, not being able to understand where the other person's point of view was, they were able to have those wonderful discussions. And so, although unfortunately he did pass away sooner than we had hoped, he was able to have those conversations and was extremely happy. And his entire family was just so grateful that we were able to do that for him.
So you managed to find hearing aids that could be recycled, essentially,
yes.
right?
Yes.
And you could
yeah, we
fix
take
them and do that.
Exactly.
And now you're doing that for Londoners, is that
yes,
right?
sir. Yes, sir. And what we're doing is we're going to be able to find hearing aids for the individual, and there are a lot of different hearing aids that we've had donated already, but clearly we need more. And then we need to have the operating funds, the capital, to be able to have those hearing aids refurbished and recased, or have earpieces made, so that those patients will be able to, those people will be able to hear and have conversations with their families, and hopefully we'll be able to help many more people rather than just those at end of life, but those all along their life path, so that they can have those conversations and be able to understand what their doctor says, be able to have conversations with their caregivers where they don't have to shout for them to hear what's going on.
It's great for you to give your time and your expertise, and pretty much pro bono. That's very special. And you are an audiologist with a doctorate in that
yes.
discipline. That's very special. Well, thank you very much.
Thank you. Thanks.